Hello, my name is Kelly Brotman. I will be discussing reducing the spread of influenza and other illnesses by increasing hand hygiene in the workplace. To begin, I'd like to introduce you to Emma Splan from Norwalk, Connecticut. She is the child in the middle. Emma was born in May 2011. In October 2017, she received her flu shot. February 13th of 2018, she was sent home early from school because she was sick with the flu. 5 days later, on February 18th, 2018, Emma Splan died of influenza complications while she was in the pediatric ICU. So clearly this is a very devastating illness. So let's review of what is influenza. It's a respiratory virus. Some people think that it's a gastrointestinal virus, and this would not be correct. That's a common misconception. It's spread by respiratory droplets. So these droplets are created from sneezing, from coughing, maybe blowing your nose and touching an item that somebody else will touch. And the severity ranges from having a fever and a cough all the way to death. So this is a deceptively dangerous illness. So who is at risk for getting it? Young children, the elderly, the immunocompromised, such as patients with cancer or maybe advanced AIDS, those living under the poverty line, and those that do not have adequate health coverage. And the reasons why these particular populations are more at risk are very wide and complicated and great topics for another discussion, but I will be focusing specifically on how to prevent it. So, there's no guaranteed prevention. The vaccine is helpful, but not foolproof, and there are many studies that examine why. But hand washing is considered the gold standard in minimizing the spread of the flu. So hand washing is actually an activity under the umbrella of hand hygiene. Hand hygiene is a number of different activities, but most people are familiar with two: alcohol-based sanitizers and hand washing with just good old soap and water. And the best part about this is that it's a simple task that anyone can perform, so it's an ideal behavior for a public health intervention. Despite how simple it is, there are various technologies available. The first is sensor-based soap and sanitizer distribution. So many people have seen sensors such as this one, the Purell distributor that can be found in public spaces, as well as automatic soap dispensers that are usually found in public bathrooms. Different cities have implemented electronic reminders in various public spaces and restrooms. And various hospitals have tried a number of technologies, such as employee badges having sensors that can detect the alcohol from Purell, or in order to see how compliant employees are with washing their hands by reviewing closed-circuit television, which is also known as a security camera. So, my intervention will focus on the theory of planned behavior. This encompasses the attitude towards the behavior. So how does the individual feel about hand washing, and what do they think about using hand sanitizers? What the subjective norm is. So what do your friends and family think? What do the people that you see on a daily basis think? Is it considered normal for your family to wash their hands before sitting down to Sunday dinner? Or will you be made fun of by your friends for always carrying a small Purell in your purse at all times? And lastly, the perceived behavioral control. So does the individual believe that they are washing their hands well? And by doing so, will they minimize their risk of illness? So my proposed intervention is to improve hand hygiene in the workplace. So why the workplace in particular? This is where many adults and some teenagers spend a significant portion of their time. There are economic benefits. Studies indicate that when employers value employee health, that the employees are more motivated to produce better work. And also, if you're valuing employee health, then fewer sick days will be used, and thus you will not lose productivity when employees are not present. Also, this targeted behavior, hopefully if successful, can be brought home and disseminated to friends and family. So there are 4 goals to this intervention. Number 1, employees believe that hand hygiene is easy and convenient. Goal number 2, employees understand that proper hand hygiene is necessary for preventing the flu and other illnesses. Number 3, employees feel that their own health is important. Number 4, each employee feels confident in his or her ability to execute appropriate hand hygiene. So to address goal number 1, hand hygiene is convenient and easy. This focuses on the theory of planned behavior's attitude towards behavior and subjective norm. So this would encompass distributing automatic hand sanitizer dispensers around the workplace, such as hallways or maybe the entryway to a meeting room. If it's physically possible, installing hand washing stations around the workplace, such as the entryway to a cafeteria or maybe employee lounge, or if there's a workshop where lots of items are handled and touched on a regular basis, that would be an excellent place for a hand washing station as well. Goals number 2 and 3, that hand hygiene is important and that individual health is important, can be accomplished by a series of educational seminars. These seminars will discuss the importance of hand hygiene, the efficacy of different methods of hand hygiene. So, for example, using alcohol-based hand sanitizer versus washing your hands with just water versus washing your hands with soap and water. Situations during which hand hygiene is appropriate, such as before a meal, either preparing it or eating it, after using the restroom, etc. And seminars can be implemented either as part of workplace meetings or maybe as standalone seminars based on whatever the workplace feels is appropriate. And these seminars also focus on the theory of planned behavior's attitude towards the behavior and subjective norm, that hopefully the attitude and norm will both shift as employees become more educated regarding hand hygiene facts. The last goal of the individual feeling confident of their ability to properly execute hand hygiene is the theory of planned behavior's perceived behavioral control. And this needs the individual to be taught a skill, to be able to practice the skill, and to receive effective feedback on the skill, so whether or not they're doing all the steps appropriately and correctly. Ideally, this intervention will conclude with a course that is taught by a healthcare professional, ideally a nurse or doctor, on effective hand washing techniques. So this professional will demonstrate how to effectively wash hands, give the employees the time to practice this while actively walking around and giving feedback on what employees are doing right and how they can correct their techniques. So in order to determine if this intervention is successful, first of all, the workplace can document their supplies of soap and sanitizer. So whether they're using more of them or if they need to order more because they're going through it more quickly. So this will indicate that the employees are actively incorporating hand hygiene into their daily work life. Documenting how much sick time employees are using. So successful intervention will be after these various methods are employed that less sick time will be used. So you can see a documented decrease over time. And also a survey to employees regarding how their attitudes have changed regarding hand hygiene and how their confidence has changed regarding hand hygiene. So that's it for my intervention. Thank you very much for listening. And if you're interested in any of the studies that I discussed or the techniques about hand hygiene or the importance, here are my sources, and there's plenty of reading materials so you can find out a lot more. Thank you very much.